Good day, sir. I am Angelee FREGILLANA, a student nurse at Notre Dame of Takaram College, BSN 2T. So today I'm going um, or to perform the prenatal care and Leopold's maneuver. So equipment is tape measure, mother baby book, tetanus toxoid vaccine, and 3cc syringe. So procedure is number one, identify the client and explain the procedure. This is to prevent errors in enhancing client to be cooperative and fan his confidence. Number two, assess client's health history, which includes personal, family, social, previous obstetrical, and present obstetrical data information gathered by the healthcare provider. And this is help establish the baseline data, identifying teaching needs. Number three is assess the client's knowledge on guidelines for health pregnant and antepartum care. This is to provide baseline data to identify teaching needs. This is also serves as baseline data for succeeding prenatal care. Number four, review the plans for antepartum care visit, examination, and laboratory findings. This is to serve as a baseline data for succeeding prenatal care. Number five, monitor vital signs of the client. This is to provide a baseline data or future comparison and identification of factors that may place the client at risk for problems. Number six is measure the height on initial visit and monitor the weight in succeeding visits. Weighing is an important part of each prenatal examination. Gain or decrease in weight will affect pregnancy. Number seven is conduct physical examination. Begin assessing from head to toe. This is to come with the general impression of woman's health and well-being. Number eight, perform abdominal examination. Number eight is instruct the client to empty or void her bladder to promote comfort on the part of the client. Number nine is position the client in dorsal recumbent. For proper positioning relaxes both mother and baby, and it also facilitates the easy location, presentation, and lying of the fetus. Number 10 is drape client and expose the abdomen from the level of the symphyoid process down to the symphysis pubis to provide privacy. Number 11, measure the fundic height using tape measure starting at 0 centimeter to determine the gestation and growth of the fetus. Number 12 is the centimeter side of the tape measure must be facing the abdomen, while the inch side is facing the examiner. This is to prevent bias. Number 13 is locate the highest point of the fundus. Leave one hand in place and secure the end of the tape measure to the fundus. Measure down to the top of the symphysis pubis. This is to measure the fundic height correctly. Number 14 is document the measurement in centimeter. This is to compare with the calculated gestation. Number 15 is 15 is perform the Leopold's maneuver. This is to assess the condition and also the fetal presentation. Number 16 is warm two hands by rubbing one against the other before placing them on the abdomen. The use of warm hands during the palpation is prevents tension and hardening of the abdominal muscles, favoring good results. Number 17 is perform the four maneuvers. During the first three maneuvers, the examiner stands at the side of the client's bed and faces the client. The position favors accurate performance of the maneuver. Number 18 is first maneuver is frontal grip. With both hands, palpate upper abdomen and fundus for consistency. Head is round, hard, bridge is well defined. And also the mobility, head moves independently, bridge less mobile. This is to determine the fatal part lying in the fundus. Number 19 is second maneuver, which is the umbilical grip. Um, with both hands moving down, palpate the side of the uterus from the top to bottom. One side smooth, hard, resistant surface or at the back, and knees and elbows. Then the other side is um, singular modulation, and this is to determine the fetal back for fetal heart tone, usually found in the lower left lower quadrant. Number 20 is the third maneuver, which is the Pollock's grip. With the right hand over the symphysis, identify the presenting part by grasping the lower abdomen with thumb and your fingers, and assess whether the presenting part is engaged in the pelvis. If head is engaged, it will not move. If it is soft, it is at the back. This is to determine engagement of the presenting parts. Number 21 is fourth maneuver, which is the pelvic grip. The nurse alters position by turning toward the patient's feet with both hands. Assess the descent of the presenting part by locating the cephalic prominence of brow. Then place your fingers on both sides of the uterus about 2 inches above the inguinal ligament. Press downwards and inwards. If the fetal back is palpated, it meets no obstruction. Then the other hand will meet obstruction. The fetal brow is palpated. This is to determine the degree of flexion of the fetal head. Number 22 is reposition the client to make the client feel comfortable. Number 20, next is administer the tetanus toxoid vaccine following the recommended schedule. First is TT1, gives as early as possible. TT2 after 1 month of TT1, TT3 after 6 months of TT2, TT4 is after 1 year of TT3, and TT5 after also 1 year of TT4. This is to prevent both the mother and newborn from tetanus. Number 24 is administer iron foliate supplement until the second month postpartum. This is to regain iron lost during childbirth. Number 25 is administer malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. Give 2 tablets of chloroquine phosphate, 250 milligram every week for the duration of pregnancy. Women are most likely to develop malaria when pregnant. Malaria can cause miscarriage, premature labor, small babies, and stillbirth. And next is provide and promote health teachings on good nutrition, personal hygiene, and enough rest and sleep to ensure an optimal environment for health, growth, and development. For 27, discuss with the client her expectations about pregnancy, which includes the dangerous signs of pregnancy, labor, delivery, and impact on the family. Psychological assessment is important to assess the client in identifying areas of need to ensure the optimal fetal growth and development. Next is plan with the mother the preparation for breastfeeding the baby to know the advantages of breastfeeding to newborn. Um, 29 is ay, 29 is discuss the importance of prenatal and subsequent visits for follow-up care.
Morning po, ma'am. Ako po si Angelee, ma'am. Student na sa Notre Dame. So, ngayon po, ma'am, mag-ano po ako ng Leopold sa inyo, ma'am. Naiihip. Gusto niyo po bang umihi, ma'am? So, ma'am, mag-ano po ako ng fundal height ng chan niyo po. So, ma'am, mag-palpate po ako para malaman po kung asa na po yung ulo ng baby niyo, ma'am. Open ko na, ma'am. Okay na po, ma'am. Thank you po.